Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside some of the best plastic surgeons in the country. Now I don't work for anybody, so I have unbiased opinions about hundreds of surgeons from across the world, and I can help you achieve the body of your dreams. Hey guys, do I have the episode for you today? You guys know I was just in Miami last week, and what I saw was crazy. And today I have a very, very beautiful lady here with me. It's Whitney DeBona, and she is a personal injury lawyer out of Florida. And I'm super excited because I know you're going to give us all the tea on what's been going down and what you've been seeing in the front lines of really the mess that's happening in Florida and along all the coast.
Yeah. Well, thanks for having me. I'm excited to talk to you today. There's definitely some crazy stuff going on.
So let me tell my girls, you guys, I reached out to her because I wanted to talk about NDAs. And I was noticing that patients were, or girls were telling me, hey, I went to have surgery here and they're having me sign a NDA. And I was like, what? Here in Texas, that's not happening. That's not happening here in Houston or in Texas, at least not as far as I know. So I thought, you know what? We need some experts in here. So, Whitney, why don't you tell us a little bit about what you're seeing, what has been coming across your desk?
Yeah. So for the NDAs, and just to kind of educate everyone, an NDA is a non disclosure agreement, which is basically a legally binding agreement that two or more parties can make, and it basically restricts one or the other party from disclosing some kind of confidential information. So it's basically an agreement that we're going to keep whatever the subject of the contract is confidential, and that can be anything. I mean, you'll see NDAs used across the board in all different industries. It's a contract, so you can contract for anything that you want. So, what I have been seeing for the most part in terms of plastic surgery centers or med spas, I'm seeing non disclosure agreements used more so after a procedure is done. You have a patient who is not happy with the outcome, and they go online and they post a bad review. And then what happens is someone from the surgeon's office or the med spa will reach out to that patient and say, hey, we saw your review that you posted online. We're so sorry that you're unhappy, blah, blah, blah. We're willing to offer you 5 free treatments of whatever, or we're willing to give you your money back if you will agree to sign this non disclosure agreement, which basically will then say, you're never going to say anything bad about them again. You're not going to talk about what happened or your results. And if you do, they can sue you for it. And then, sign this agreement and we'll give you your money back, or we'll give you the treatments or whatever. So that is kind of the context where I've been seeing those agreements used more often. In doing a little bit of research for the podcast today, I did come across a recent situation. There's a surgeon out of Seattle who just got in a lot of trouble for making patients sign these non disclosure agreements pre surgery. And the agreements that he was making the patients sign were just crazy. I mean, he was basically, having them say, if I have any issues after the surgery, I will not, post anything online. I won't talk to anybody else about it. I'll bring my complaints directly to back to the surgeon, basically. And then he had a bunch of other issues going on, but basically, any a negative review that would violate his non-disclosure agreement was anything less than 4 stars. He had very specific things laid out in this non-disclosure agreement about what the patients could or could not say.
Wow.
In addition to that, he was then instructing all of his employees to go online and post fake positive reviews.
Big
Um,
trouble.
so yeah, he had a lot of stuff going on, but I did see that was kind of a recent situation where somebody was in a lot of trouble for having their clients sign these pre-procedure non-disclosure agreements. That's not something that I have actually seen in any of the contracts that I have reviewed so far in Florida. So I'm curious, any of the women that have told you that they were being asked to sign those, were those pre-procedure?
They were post procedure.
Okay. Okay. Yeah. So like I said, I haven't really been seeing anything like that in a contract pre-procedure. If you see anything like that in a contract, don't
Red
sign
flag.
that. Big red flag. I mean, if somebody's already telling you, hey, if you have a complication or problems,
You
you
can't
know,
talk
you
about it.
you can't tell anybody about it. That's a big issue. So, but yeah, I'm seeing them more so in the post procedure context.
So once we started talking, Whitney mentioned to me a lot of the things that she's seen in recovery homes. And recovery homes is such a huge topic because it's kind of it's taken off in some places, other places it still hasn't taken off, and but it's coming. It's headed in every city. It's going to be everywhere before we know it. So tell us a little bit about what you're seeing in the recovery house world.
So, uh, where do I begin with the recovery houses? So, to be completely honest, I did not know that recovery houses existed until fairly recently, since I started kind of doing all this research and taking some of these cosmetic related cases. And I was kind of shocked. I was like, wait a minute, what do you mean you're you went to some recovery house that you weren't given the address of beforehand? You Venmoed somebody some cash. You got picked up in a black van outside of the surgery center and taken to some unknown destination. Like, when I first started having people tell me about these places, I was like, what in the world is going on? Like, I was in shock. But I have unfortunately come to know that these are very common in South Florida in particular. People traveling down to Miami for cosmetic surgery. There's a ton of these places. They are advertised on social media for the most part. A lot of the girls hear about these recovery centers directly from the surgery centers. So they'll have like the surgery coordinator or a nurse or somebody say, oh, hey, I've got this great recovery house. And they just give them somebody's contact information. Most of the communication is kind of done over text message. They never really talk to a person on the phone or anybody with, I don't know, it's from what I've seen, it's been mostly through text message. And then, like I said, it's, hey, here's the price for however many nights, and Venmo me this money, here's my Venmo. And yeah, they get picked up by, they just kind of get wheeled out the back door of the surgery center, and then they get picked up by some unknown person who then takes them to this recovery house. And what I've been told by a lot of these women that I've talked to is that once they get to the recovery house, it looks nothing like the pictures that they saw on social media or whatever they were told, it was going to be like there. They will go to this house. A lot of them are just literally houses in residential neighborhoods. So you'll find like just a 4-bedroom house on somebody's block being used as a recovery house. And they might have 20 people in there recovering from surgery. And it's so crazy to me and a big problem. And so some of the women that have reached out to me, it was situations where they had surgery in Miami, they went to a recovery house, they got some kind of horrific infection. And, they found me and they're contacting me saying, hey, what can I do? Can I, do I have a lawsuit? Is there anything that I can do? And I hate having to tell people this, but, you know, when you go to one of these recovery houses, they are not sanitary. Nobody there is following the proper procedures for, getting rid of all the waste and the bloody bandages and all the stuff that's in there. You've just put yourself in this terrible situation in this house full of bacteria. And I hate to tell everyone, but these people are running basically a scam. They're not legitimate businesses. They don't have insurance money. So if you go there and you stay in their house and you get injured or you catch you catch some kind of bacteria or whatever infection, who are you going to sue? There's there's not going to be any money anywhere for you to go after, because as soon as these places open, they shut down and they move to a different location and they change their names. And, it's just, I don't know. It's the craziest thing that I've ever seen. And so I'm always talking about the recovery houses, especially in Miami. You just have to be so careful. Careful in Miami in general, because a lot of these surgery centers down there are just, they're complete mills. They do not care about you. They want to take your cash and then send you to one of these recovery houses. And when you have a problem, you're going to be,
SOL.
yes, exactly.
I've heard some tragic stories of girls who were in recovery houses and all of a sudden police are there. They're getting kicked out of this house. They have their incisions are they're fresh out of surgery with draining, and now they're out in the street with nowhere to stay because this recovery house is closed.
Yep. And I just saw a news story about another one that just got busted in Miami. I think it was last week or the week before. And that's the thing. They just find these women in there. And guess what? They're arresting all of the caretakers. And these women are just kind of like, okay, find your way back to wherever you came from. So yeah, it's a very big problem. And we just don't have enough resources in our state to really be cracking down on these places the way that we should be. And it's really, really sad when I talk to these women that, find themselves there. And something that I want to point out too is I've been kind of shocked at just the way the whole thing goes down. But I think that women, they go down there, they're trusting these surgery centers, they're trusting, these people that they are looking out for them. And they, I don't think it crosses their mind that their surgeon or their surgery center would be sending them somewhere that's not legitimate. And so they tell me kind of, when we walk through the whole process of how they ended up in this recovery house, it's really like, they're like, well, then I thought this was kind of weird, but, I just thought, oh, okay. And then I thought this was kind of weird, but, and it's always like, I thought all these things were weird, but then I just did it anyway. And then by the time they wake up in the recovery house, it's too late. They're there. They've already paid their money. They have nowhere to go. And they don't even know where they are. That was one woman that I talked to, was telling me that she woke up in this recovery house, and she said that nobody in the whole house spoke English, so she couldn't even communicate with anyone to
To
say, where
say,
am I, where's my medication, where, like, she couldn't communicate with anyone. So then there were basically two, she said they were like preteen, teenage age girls that were in there basically taking care of the people that were recovering. They were, I guess, the daughters of the woman that was running the house. She was told there was going to be registered nurses there taking care of her. And, there wasn't a nurse in sight, but she's in there and she's like, I'm trying to call my mom. Like, you got to come get me out of this place. I don't, I
I
gotta get
don't
out
feel
of here. And,
safe.
and her mom's like, where are you? And she's like, I don't know. They never gave me the address. Like, I don't even know where I am. So she's on her phone with like the locator thing, trying to figure out where she is so that she can get help to come and get her. And, people have traveled from out of state to go to these places. They don't have anybody that can just come pick them up. So it's just, oh, it's really, really scary. And I just tell everyone, like, please do not go to these recovery houses. I don't know what else to I don't know what else to tell people, but you find yourself there, you get injured, and then you're gonna have basically, you're gonna have very limited options in what you can do.
Well, what I like to do on the show is educate our audience on how, okay, well, if I can't go there, well, what do I do? How do I recover? So I know there's different laws for each state as far as to how it all works, right? So what can our audience, our girls who are listening, who maybe have surgery coming up and they were thinking of having surgery or booking a recovery house, What should they look for?
So this is going to differ probably state by state. In Florida, for the services that most of these recovery houses are offering or advertising, they are supposed to be licensed as basically an assisted living facility. Um, and so that's going to give them some kind of regulation. There's rules that they have to follow to have that license. Even with that, I would still be very careful, where you're going. I would not go to a recovery house. If you haven't been there and been able to like see the facility beforehand, I wouldn't go there. You want to find out who are the actual providers that are going to be there taking care of you. Are they actually registered nurses? If so, okay, what are their names? I want to look up their license and make sure that, if I'm expecting the care of a registered nurse, then, you know, I should be able to have her name and make sure I know who's going to take care of me.
Make sure her license is active.
Exactly. And then I know that there are some recovery centers that are more of like an outpatient hospital kind of setting. So I think that that's probably something that's going to be a way safer bet. And then another option that I would probably go with over any kind of recovery house would be just either renting an Airbnb or getting a hotel and paying a registered nurse, to come and take care of you after the surgery until you're, recovered enough and can go home. I think that those are a couple of things that are better options than going to a recovery house with somebody that you Venmoed and have never met and, you know, waking up in a world of danger.
What other types of injuries are you seeing come across your desk from cosmetic or plastic surgery related?
So, since I've really been taking or at least investigating these kinds of cases, I've seen everything from I just settled a case for a woman who went to a nail salon and got her arm waxed, and they literally ripped off her entire arm because they burnt her with the wax.
Oh
I
my
have,
God.
yeah, I have quite a few cases involving either some kind of like a laser or a peel situation where they were left with scarring. I have a case with a woman who went to a med spa for just a everyday run of the mill facial, and she ended up with a really bad infection because of the equipment that they were using, and she ended up with this big scar on her face that had to have surgery. And then I've had some more serious cases, like amputation from a BBL that had complications that weren't taken care of. So, I'm seeing things kind of the whole spectrum of, things that can go wrong whenever we sign up to do these cosmetic things that we do to try and, stay young and beautiful. And, it's something that, we all want to look our best and feel our best as we age. But I just think it's really important for us all to realize we need to do our research and we need to really understand the things that can go wrong. And I'm learning still every day. I'm like, oh my God, I didn't know that this could happen from this or this could happen from that. So, it's really just making sure you understand and know the risks and that you're going to someone who is legitimate and knows what they're doing.
Absolutely. And you know what? The crazy thing is, ever since I launched this show, and I've realized more and more and more, it's hard for them to decipher who's legit and who's not legit because they put on a good show.
Yep. Yep. Absolutely. And social media and the internet makes it, 10 times harder to tell what's real and what's not. One other thing about that surgeon that I was talking about earlier, they said that basically he had a huge social media following, but they found out in this investigation that basically all of his followers were paid fake followers. And that's something that I see a lot with, plastic surgeons that I see online. People that know how to look for fake followers, it's typically pretty easy to tell, but most people don't know what a fake follower looks like versus a real follower. So they just go, oh, this guy has 200,000 followers, he must be legitimate. And he's
That's
not,
not the case.
exactly. And then same thing with the paid reviews, they're you can't always trust the reviews because they're paying people off to take down the bad ones and or rewarding people for giving good ones. I've seen that too. So it's very, very hard.
For me down here in Texas or in Houston, the facilities that I've worked with have always been so respectable, so like we are doing everything right, exactly how it's supposed to be. When we did ask for reviews, we knew we can't entice them in any way. It has to completely come from them. And I, with my basket of daisies, was going across the forest thinking, oh, everywhere is like this. It's all like this. And as my show started and I started to realize more and more and more and more, and I would talk to more women and hear more, and I'm like, oh my God, this is not at all how it's supposed to be. You guys are
No,
not, this is not how it's supposed to feel. You're not supposed to feel rushed. You're not supposed to feel scared and left alone after surgery. You're not supposed to feel like you got taken advantage of because they just bait and switched you the day of surgery, and now you thought you were having lipo and now they're telling you have to have a tummy tuck and you have to pay $8,000 right now or you lose all of your money and your deposit and everything you've paid. The first time I heard that, I cried with the girl. I was like, I'm so
yeah,
sorry that this is happening to you.
yeah. I've cried with women that I've talked to as well because it not only is it being upset because you've lost your money and you've gone through this traumatic experience, but anything cosmetic related, it's such an emotional roller coaster. And you're going in and having this procedure done, whatever it is, because you want to come out feeling better about yourself and you think it's going to make your life better. And then when you have something terrible happen or you have a complication or your surgery is botched, it's extremely emotionally upsetting. And the women that I talk to, are just, it kind of consumes your life when you're dealing with that and going through something like that. So it's, yeah, it's just really, really sad.
The people who
All
we
these
think,
providers.
yeah, the people who we
Yeah.
think, well, if they have a facility, if it looks legit, if everybody's it's acting like everything's perfectly normal around here, it must be. There's no
Yep.
reason for a patient to be suspecting of everybody everywhere. Be cautious because we're trusting. We're like, if this is up and running, if our government's letting it run, then it should be fine. But the
Right.
reality is that it's not.
No, it is not.
I had an interview with a patient who went to TJ and she had a terrible experience and got botched. She had terrible like third degree lipo burns all over her torso. And I remember in that interview something that she mentioned was, don't judge me or us for looking for surgery and blame us for being for this happening because we thought we were doing the right thing. I did my research. I looked him up. I heard from other people that had surgery with them. So I thought I was doing the right thing and now I have to live with this for the rest of my life and I can't even look in the mirror. And that was an episode if you want to go back and listen to that one, the episode is called I Was Botched in TJ and I'm Not Alone.
It's it's really sad, and the going to the whole blaming, the patient who went and had this procedure done. I think there's an interesting thing happening right now because, you know, obviously you're going to always have the people that are out there that are like, well, you went and did this, you went to have surgery that you didn't need, or you went to have this laser that you didn't need, and you're so vain and blah blah blah. um you're always going to have those people, but I do think there's, a huge kind of shift happening in our society where, with, first of all the online, the filters and everything, like we don't even know what real people look like anymore. And more people are opting for cosmetic surgery and cosmetic procedures. And, we have all of these things that are available to us now, to where it's not, I think in the past, people looked at cosmetic surgery and all these treatments as something that were just for like the rich and famous, or only celebrities did that. And now it's, you've got your Starbucks barista saving up her tip jar money to go and get, a tummy tuck or whatever. And it's definitely becoming more widespread and more accepted. But with that, it's a big money industry, and it is not, these are not medically necessary procedures. And so that just opens the door for people that are coming in that really truly only care about money and don't have the patient's best interest at heart. And it's everywhere. It's the plastic surgery centers. It's also, the med spas. We've got in Florida right now, we have a med spa opening on a different corner every single day. And they're offering, all of these different services, and nobody knows what they're allowed to be offering and what they're not allowed to be offering. But if you go in there and they say, hey, we offer this procedure, you assume as the patient that they're allowed to be doing that. And it's just crazy. So yeah, I think the more and more that plastic surgery and all of these procedures, as they become more accepted, and we have all-time high numbers of people seeking out cosmetic procedures. So it just opens the door for, there's a lot of wonderful providers out there. There's a lot of really great skilled surgeons and nurse practitioners, nurse injectors, people that are out there that,
Care.
really care and have done the training and have, are doing the ongoing education and making sure that they're staying on top of everything. And those people are out there. But for every one of those, there's, yeah, I
10.
mean, I don't know, 10, I would say even higher, maybe 20 bad ones. And yeah, it's just gotten really, really hard for people to know how to find the good ones, unfortunately.
Unfortunately, you know what? I realized with this show that patients want to know. They want to learn. They're researching. And I believe around the time when I was launching my show, there wasn't a lot of reliable information other than what they were finding in the Facebook groups and what they were finding on Real Self. And you guys, if you've listened to that episode I had with Aria where we were talking about reviewing the reviews, y'all know they can pay to have bad reviews removed on Real Self. So you cannot completely rely on those reviews to decide if that surgeon's a good surgeon or not, because you don't know if that surgeon is having negative reviews removed from their account. And I've had patients in my DMs sending me screenshots of them posting a negative review and then a screenshot of their negative review not there. So I know it's happening. It's not that it's not happening. It's probably happening more often than you think. So when you are doing your research as a patient, it's almost like, okay, well, how do I know? How can I know that this person's going to do a good job on me, or that this person is supposed to be doing these procedures? And one of those things that I always say is, or think, if it's a board certified plastic surgeon doing your procedure, that should probably be the first question. What do you think?
Yeah, that should be the baseline. Like, let's just start there. First, are you a board certified plastic surgeon? That should be like the bare minimum of research when, somebody's looking for a plastic surgeon.
You would think, but we've had a lot of episodes about this, about the different wording and how they use different verbiage to make you think that actually a cosmetic surgeon is the right surgeon for you for the type of procedure that you're looking for. When in reality, it's so across the board skewed in one direction versus the other. Because on the other side, there's also newer plastic surgeons or younger plastic surgeons who maybe aren't as experienced, who can also have um, complications or get themselves into trouble one way or another. But they have that training as a baseline,
Right.
right? Versus the cosmetic surgeons who maybe they've had a ton of experience. They've been doing cosmetic surgery for 10 years, but they don't have that baseline training that the plastic surgeons do of handling complications and handling things that come from plastic surgery. Because as you and I both know, It's not risk free ever.
There's always going to be risks. And, um, like I said, the baseline should be board certified plastic surgeon. And even the board certified plastic surgeons, guys, I've had women call me, and again, it's some of these places in Miami, and I should take that back. There's a place here in Tampa that I keep getting a lot of calls about too that I'm hoping I'm going to get them shut down because it's just ridiculous. But yeah, I mean, you can't just say, "Oh, they're board certified in plastic surgery, so case closed. That's who I'm going to use." There's a lot more that you need to look at, and I know it does become extremely difficult to sift through it all, which is why I think finding a really good consultant that can help you, kind of like what you do, and even with that, there's people popping up in your field that there's a lot
Don't
of
have
scammers there too.
anything to do with surgery. You know what? I'm so glad you brought that up because I want to talk about this. I haven't talked about it since I launched the show. When I launched my show, I made a very firm stance. Anybody that I refer to, I'm referring to them because I believe in them and in their work. I do not receive commissions from anybody. I do not get kickbacks from anybody, and I have a very firm stance on I don't want any doctor in my pocket. There's because I want to clear headedly, without any judgment, be able to say they're not doing the right thing. Bye. We're not talking. I'm not referring to them. There's nothing that they can do to make me keep referring to them. And if you guys are with a consultant, you might be with somebody who's receiving a kickback from the surgeons that they're sending you to. And I have like 5 on the top of my head that I know for 100% are receiving kickbacks from the surgeons that they're referring to. And one, it makes me really upset because I think it's very, very conflict of interest. You should not, and I think w- everybody, if you are receiving a kickback from the surgeon, tell the patient, hey, you book with him, I get a kickback for you booking with them. And if they're not telling you the truth, then why aren't they telling you the truth? They should be. That's the first thing. The second thing is, while I was in Miami, I learned something that completely shocked me. I knew these places were mills, but I got a number. Okay, so in my experience, plastics, like very, very busy plastic surgeons, they do maybe like 30 to maybe 40 surgeries a month, right? Like that's a really busy, very, very busy surgeon. I got from a very reliable source that in at Mia, they were booking 600 surgeries in 2 months. So how how that the number how now everything makes so much more sense. Oh, okay. Now I understand why all of these people are getting hurt. Now I understand why these people are getting infections. Now I understand why the rooms aren't being turned over properly. Now I get it. These numbers are crazy. 600 surgeries for one surgeon in 2 months is insane. Blows my mind. How is this allowed? How is this possible?
It's crazy. We had a regulation passed in the state of Florida within the last couple of years. I can't remember when it went into effect, but basically they had to limit because we were having so many women die here from BBLs. They created a whole task force and tried to figure out why was this happening. And one of the issues was that these surgeons were doing like 15 of these a day, and they would start them at 5 a.m. And one of the women uh, who died in the state of Florida, I think she was, I want to say, I don't know, like the 11th or 12th surgery that he had done that day. And I mean, he didn't start her surgery until it was like 11 o'clock at night or something. So, I mean, they were just lining these women up, doing surgery after surgery after surgery, to the point where the state had to step in and regulate it. And, you would just think that the surgeons would say, hey, this isn't safe. It's not safe for me to be doing this many surgeries, this very, very complicated surgery with very high risk. It's not safe for me to be doing 10 of these in a day, back to back to back, without taking a break, starting at 5 a.m. and then still, cutting people open at 11 p.m. at night. I mean, you would think that the surgeons who have taken, an oath to protect their patients and, to look out for their patients' safety, you would think that they would kind of check themselves and go, I shouldn't be doing this. But that's where that whole, what I was saying before, it's the money and it's this booming industry, and people get blinded by that. No matter how much schooling you went through, no matter how, the license that you have on the line, if you're going, hey, I can do X amount of surgeries a day and charge this amount of pop, and there's nobody regulating me or telling me that I can't, that's when we have real problems. And I think that that's where a lot of the issues with all the cosmetic surgery stuff that's going on is, um, the lack of regulation. Nobody is really stepping in and saying, hey, you can't do this.
I'm curious to know what you have heard about the ghost surgeons,
The ghost
the
surgeons.
the ones that are in the back. One surgeon is like the face, and there's
Oh,
there's like the techs that are supposed to be like assisting in surgery, but they're actually doing the surgery. They call them like
yes.
the ghost surgeons. That's how they're
Yeah.
doing it. That's how they're getting through that volume because they have other surgeons in the room. Although, from what I've heard, it's surgeons who are surgeons in other countries, and then they come and they have different certifications here, but they're surgeons in another country and they're coming here and they're assisting in surgery, but they're not board certified plastic surgeons here. They're
Yeah.
surgical techs or different things.
Yeah, I've heard about this, and I've heard about this whole thing of like one surgeon starting the surgery, but then they leave and like somebody else comes in and finishes it. Or, maybe you have a board certified plastic surgeon who is supposed to be the surgeon doing your surgery, but then mid surgery they let like a surgery, somebody that's in training, that isn't completely done with their school, they come in and take over. And I understand that in those kind of situations people have to learn how to do their jobs right. But the patient, if you think you're getting a board certified plastic surgeon with 10, 20, however many years of experience, and midway through the surgery he's going to bring in somebody that's in their residency or whatever, and that's coming in here to do training, you should be notified of that as the patient and decide whether or not you want to consent to that or not. Some people are fine with that and they'd be like, oh yeah, as long as you're there to monitor or whatever, I don't care. But some people are like, heck no, I don't want this person to operate on me. So, but yeah, I think that a big issue with when you have these big surgery centers, and I'm seeing different surgery centers that are now like nationwide, they have offices in all these different cities, and they fly these surgeons around in between all the different centers, and you don't know what surgeon is going to end up doing your surgery. Because I actually had a lady reach out to me the other day, place in Miami, and they told her like the day before her surgery that the surgeon that was going to do her surgery can't do it now, so they're just swapping out her surgeon with another surgeon. And she's like, I'm not okay with this, like this is not what I agreed to, I wanted this surgeon. And I've had other women tell me that, and then it's again, they've already given their money, they're not going to give you your money back, it's either take this surgeon or leave it, is basically what they tell them. So, but I think when you have these really big practices with a lot of different surgeons that are, coming in and going out, you don't know who, once you get in there and they put you under, I mean, you don't know who's going to be in the room operating on you. So, uh, I don't know what the answer is for that, but, yeah, the ghost surgeon situation is definitely alarming.
It is very alarming. I know that of course, surgeons do have to learn, and There's facilities though, like for example, the residence clinic. That a lot of different places have the residence clinic where it's plastic surgeons who are doing their residency, they're getting their training, and women sign up for surgery with them, knowing that they are in training and getting a discount on their procedure. So they're not paying top dollar and getting a different surgeon. They know that they're getting a surgeon that's in training, and a lot of these surgeons they're amazing. They're gonna finish their residency, open up their practice, and have booming uh, businesses and very busy and great results. So I think it's there's a place for it if the patient is aware, if they know what's going on. And I feel like for me, something very personal, I hate having my power taken away from me by a lie. Like if somebody lies to me and it takes my power of making a decision about something, that makes me more mad than anything than the lie, because that what if I wouldn't have decided to do that if it wasn't for this information. So I feel as a patient, these all of this information is important in order for them to be able to make a decision on, do I want to have surgery here with this surgeon, with the how he does it. And what I like to tell my girls is, just because they do it like that doesn't mean you have to accept it. You take your business elsewhere, you go somewhere else. Just because, oh, this is how I do it, this is how they do it, doesn't mean it's okay, and it doesn't mean it's right. And you still have the power to decide, hey, I'm not okay with this. And I like to say, if you see something, and like you were saying earlier, oh, I saw this and I thought it was weird, but I still kept going. Oh, I saw this and I thought it was weird, but I kept going. At what point do you say, hey, let me get up? But I just saw a rat run across this room. Maybe I need to
Yes.
get out of here and run.
Yes. Yes. I've literally had women tell me things like when they got into the surgery room, they saw rust on the like on the equipment and the IV bag and all this and I'm thinking, and you let them just cut you open, but again, it goes back to once you get so far, you've already paid your money. You know that, you're not going to get your money, but it's all usually the money to me, I think is like the biggest thing that stands out that people tell me is, I've already paid all this money. I'm already in the hole so far. I've just dumped my life savings. I gave them $11,000. What, that's all the money that I have. And here I am. If I just walk out of the room, they're not going to give me my money back. And I know that that is a very difficult situation to be in, but again, it's your life. And if you get into the operating room and things are shady and you see a rat run across the floor or whatever, it might be worth it to lose whatever money you're going to lose and, not potentially risk your life or end up with some kind of horrendous complications or problems that you're going to deal with for the rest of your life. And guess what? You're going to spend tens of thousands of more dollars to try to have additional surgery to fix whatever that person did.
Hmm.
You get some horrible infection, and some of those infections are very difficult to treat. You could be on antibiotics for years and having to go in and get things drained and just ongoing treatment. So you might lose some money in the short term, but is it worth it? So
And this is actually something that's happening, across the board. I see stuff like this happening from people who go to Colombia, or they go to the DR, they go to different places, and these things are happening. Um, One person that, really comes to my mind when I think about botched and I think about having a terrible experience, is a client who came to me who had lipo in the DR. And you guys know, in the DR, they do like ridiculously aggressive liposuction. Very, very aggressive, which I know to some women, they love that. But I don't think it needs to be that aggressive. There's a reason why they do it the way they do it, for it to look good. So one of those things is that in the DR, they like liposuction you so much that there's no fat. When you pinch your skin, there's nothing in there. It's just skin. Well, one of the risks when you have liposuction is contour deformities, or you can see some of the irregularities underneath your skin. When you remove that whole layer of fat, there's nothing there to camouflage, to hide anything that's irregular underneath the skin. And this girl who came to me, like, they had done such aggressive liposuction. It looked like she had gravel underneath her skin, all her torso, everywhere, all the way around. And it was very heartbreaking because you guys, that is really hard to fix. Like
That's what
that's
I was gonna say. What do you even do at that point
That
in
is a
terms of,
really hard fix, and I tried to find her a surgeon. I really tried. I reached out to as many as I could. I sent her pictures. I really please, can you help my girl, please? And I asked multiple surgeons, and they all turned her down. And this lady was like, she wasn't American. She was from another country, and she was a very wealthy woman. And she was like, I will pay whatever they want. I'll pay it. I will pay whatever money they need, whatever it costs to fix this. And to have that conversation with her and telling her, I can't find anybody to take your case. I can't find anybody who will fix this. It's not about the money. It's about they won't take your case if they don't feel that they can improve it, and they don't feel that they can improve your result. That, to me, like, it still breaks my heart because I know her pain. I could feel her pain through our phone calls, and I could feel her pain through the pictures that she was sending me. And it still breaks my heart because that nobody deserves that. When you're going in for a plastic surgery procedure where you think you're going to look better and you think everything's going to be great, and you come out on the other side and it's the worst thing that's ever happened to you, it's absolutely crushing. Crushing. It's part of my motivation. It's part of why I do what I do, because I don't want that to happen to any other woman who there's no fix. We can't fix it.
yeah, I think, it's just getting out as much information you can on the front end to try and help people so that they don't end up in that situation where they're calling you saying, "Hey, I need fixed," or they're calling me saying, "Hey, I need to sue somebody," because once you're on that side of it, it's a really, like I was saying earlier, it's just an emotional, really hard thing to go through. Um, and also financially, it's a huge burden. So, uh,
Well, before I let you go, what tell me more about this, that they don't require malpractice insurance in Florida?
yeah. So in the state of Florida, and I looked this up not too long ago, and I do not quote me on the numbers, but I believe it was over half of the states in the country do not require surgeons to have medical malpractice insurance under various different conditions. So every state is going to be different. But I was surprised that it was that many states. But yeah, in the
That's a
state of
lot.
Florida, it's a lot. And I think this is something that people would have no idea to ever even think about or question. Of course, I have to have insurance to drive my car down the road, or it's a crime in the state of Florida to not have car insurance. So surely plastic surgeons have to have insurance to operate on people, and they do not. Um, so
How?
if
I
they meet
can't believe
certain
it.
if they meet certain qualifications under the statute, they do not have to carry it. All that they are required to do is hang a sign in their office somewhere that is like visible to patients. There's no real, it's not like it has to be a, giant sign on the front door or something like that. They have to have a visible sign that informs the patient that they do not carry malpractice insurance. And this is something that nobody thinks about beforehand. And I have seen surgeons where they actually do include that in their contracts here, where it'll say, I do not carry medical malpractice insurance, blah, blah, blah. And the clients sign off on it. but I know that they don't even know what that means really, or, just, I don't know. I think it's just something like what, I don't know. They're like, yeah, I guess I read that. I don't know. I don't know that everybody actually reads their entire surgery contract either,
They
but
don't.
they definitely don't. Um, but yeah, so then the problem becomes, well, once you have a problem, you have a complication, and you go looking for a lawyer to represent you, the first thing the lawyer's going to do is go look up the surgeon to see if they're insured. And what we have in Florida is this. So typically, if you're going somewhere for medical treatment, like a hospital, or something for medically necessary treatment, usually the hospitals have insurance. The They usually have some kind of requirement that the surgeons that work in the hospital carry insurance. So this isn't something that you need to always be running around checking to see if every medical provider that you have has insurance, because most of your medically necessary kind of doctors, they're going to carry insurance for one reason or another. But these plastic surgeons, a lot of them operate out of their own plastic surgery facilities, and they don't have to have insurance. And also, not only do the surgeons not have to have insurance, but the surgery facilities do not have to have insurance. So it's a double whammy effect of, well, I can't sue the surgeon because he doesn't have any insurance. And I also can't sue the surgery center because they don't have insurance either. And you can still sue, you can still bring a lawsuit against someone even if they don't have insurance, but it's hard and there's no chance of recovering against them. There's situations I've seen where, somebody took a case against a surgeon, they took it to trial, got a jury verdict, and then the surgeon filed for bankruptcy. So, there's ways around it. They know how to protect their assets and their money. And it really puts the patient at a disadvantage. But most patients don't even know beforehand that this is something that they should look for and make sure that your surgeon has insurance. So, yeah. So, in
Just
addition to a board certified plastic surgeon, the next question, in my opinion, should be, do you have insurance in case something happens to me? And, that's something that I always tell everybody to double check on. So,
You know what's so interesting? I heard from a surgeon down there, "Oh, well, if I get malpractice insurance, that's just gonna put a target on my back." Okay, if you think so. I don't think so. I think it protects you and the patient, but sure.
there's definitely different schools of thought with that. But yeah, it's just your reputable surgeons that are practicing in reputable facilities are going to have insurance. That's just, that's the bottom line from what I have seen. I don't know of any, highly credible, highly reputable surgeons that don't have insurance. They're going to pay the extra money to have that, to protect themselves and to protect the patients. And it's, these people that are like, they just don't care. They're the ones that are down there operating with no insurance. And unfortunately, because plastic surgery is the wild, wild west, and as I was saying earlier, there's just not enough regulations and not enough people, looking into this area and trying to see how we can make it better. So it's people are just going to keep doing whatever they can get away with. So
Well, I hope in the future, maybe in 2024, we'll see some more positive change in the right direction for all of our girls who are looking and men who are looking for surgery and are looking for reliable surgeons who can take good care of them. I hope those keep floating to the top and the bad just sinks to the bottom.
yep. I think as people become more educated and there's more information available on social media and online to just kind of help people realize you have to be really, really careful. I think it's going to weed some of the bad ones out. But unfortunately, like I said, just with the number of people looking to have these procedures done and the number of people entering this field just for the money, I don't know. I hope that things are going to be better. I hope that we're going to get more regulations and states cracking down on some of the stuff that's going on a little bit better. So we'll just have to see. But in the meantime, I think just spreading awareness and education, I mean, that's really all that we can do. So
Absolutely. So before we end our episode, give our listeners, as if they were your sister, your best friend, your number one tip on their plastic surgery journey.
whew, my number one tip, um, I think it would be don't trust everything that you see on the internet. You have to go beyond that. You need to actually go meet in person with multiple surgeons, have questions, do your research before you go in there so that you can ask them questions. Um, don't just show up at a surgery center the day before and meet your surgeon for the first time. Then, just you have to really, really vet who you're going to let touch your face or your body. And again, I know that's just such an easy thing to say. Do your research, do your research. Because then everybody's like, well, how do I do my research if all the research is, I can't trust it, So I think you just really have to, you can't trust everything online. You need to go to the place in person. You need to meet with the surgeons, look up their credentials, see if they've ever been disciplined, see if they have other malpractice uh, suits that they've dealt with in the past.
How
There's a
can they
lot of
look that
different
up?
things. So in the state of Florida, most of our court records are public record. So there's two different ways you can look it up. So you can actually go to the Florida Department of Health website and you can do a search for any medical professional in our state. And there's a tab on there where you can look and see if they've ever had, if they've ever been disciplined, that will show up there. If they have ever had any malpractice claims against them, that will show up there. And it'll show actually, they have to report the amount that their malpractice insurance paid out. And then a step further that you can take, which is something that I would do, is go to the actual county where that surgeon practices and you can search the court records. So you can search for their name or their practice name, and the court records are public act or they're accessible to the public. So unless it's super old or something, sometimes you can't see all the records on there anymore. But you can actually go on there and read the complaints. You can read, anything that is public on there, and you can see, well, all right, what did they do? Let's do a little reading here and find out what this person says they did. And it's just another thing that you can do to kind of take that one extra step. And because people will find out after the fact. They're like, I did this surgery and then I found out that he's had all these prior malpractice suits, or this is the one that kills me, is this person is actively being investigated by the medical board and has an ongoing investigation, but they're still allowed to practice and run their practice. And then people find that out and, they have no idea. And there's no requirement that they have to report that to anyone. So checking, checking with the medical board in your state, I think is also a huge thing that you should do, just to try and protect yourself.
Just before you sign on the dotted line, just make sure. You know what? Let me dot my I's and cross my T's and make sure that I'm going to be good before I
Yep.
sign here.
Yep.
Thank you so
Absolutely.
much, Whitney, for coming on the show and sharing all of your knowledge and experience with us. I really appreciate it. And if my girls want to come look for you, how can they find you?
So they can find me on social media at Beautyjusticewhit. And I have a new website that's going to be launching in a couple days, and it's just beautyjustice.com.
Awesome. Thank you so much, Beauty Justice Wit. That's how I found her on IG, you guys. So go check her out. And if you need anything, she's always there to be a helping hand and she'll lend an ear to help you.
Yes, absolutely. And I'm working right now on kind of a referral network with attorneys in other states, so that, because I've had some women reach out to me from social media that are from, somebody called me from Hawaii, and I'm not licensed
Wow.
there, but Yeah, this is happening everywhere, not just in Miami. So, I'm trying to build a little network of attorneys that are interested or knowledgeable about these kinds of cases so that I can help women in other states, not just Florida. So even if you're not in Florida, if you want to reach out to me, I'm happy to see if I can help refer you to somebody that might be able to help you with whatever your situation is. So just let me
Wonderful.
know.
That's an amazing resource. Thank you so much, Whitney. We appreciate you so
Thank
much on the
you.
show, and I will see you guys next week.